Hello everyone. Today we are going to discuss about road accident trauma care and what's happening inside our emergency department. So whenever we receive an accident patient, we have a specialized area called triage area that is equipped with stretcher and supportive devices like C-collar and spine board. We have a trained triage staff who used to look for any life-threatening injuries for the patient who arrived in our department. So whenever we receive a drowsy patient, we always assume the spine injury until proven otherwise. By doing so, we always stabilize the patient using C-collar and spine board before shifting them into the emergency department. So when we receive the patient into the emergency department, we prioritize them and put them into a particular color zone based on their severity of the trauma. So in that particular zone, we emergency consultant start assessing the patient using certain signified approach called primary survey. The approach is X, A, B, C, D, E. So X is nothing but looking for exsanguinating hemorrhage or severe profuse external bleeding. By looking so, we need to control the bleeding using external compression dressing or hemostatic dressing or tourniquet applications. After the X, then comes A, which is airway. In airway, we always look for injuries over the face, mouth and neck region and also look for saturation of the patients. After looking for that, we need to support the airway and we need to maintain the patency of the airway either using basic airway or advanced airway. After that, we need to assess the breathing status of the patient by looking for the chest movements, by checking the air entry on both sides of the lung, and afterwards we should look for any collection in and around the lung, either hemothorax or pneumothorax. If we have any such problems, we need to intervene the problem parallel to our assessment by the procedure called needle thoracostomy or chest tube placement. Next comes the circulation part. Here we look for heart rate, blood pressure and any minor hemorrhages all over the body and try to control it. If we have an unstable blood pressure, we need to secure a large bore IV line and treat them with IV fluid and blood products available with us. Then we also look for any internal hemorrhage over the chest and abdomen region using ultrasound scan and proceed for further specialty evaluation. Then disability. In disability, we look for neurological status of the patient. The neurological status like assessment of the level of consciousness of the patient and size of the pupil and power of the limb. In case there is any compromise in these parameters, we always push the patient for CT brain imaging. Then exposure. In exposure part, we need to completely expose the patient and look for any injuries by using log roll technique. After the complete examination, we need to cover them with warm blanket to prevent them from the hypothermia, which means lowering of body temperature. So after completing the primary survey along with parallel interventions, we need to take two pathways. One is stable pathway and another is unstable pathway. In stable pathway, the patient gets stabilized in the primary survey itself and then will proceed for further CT imaging workup, blood workup and specialty evaluation in the emergency department itself. In unstable pathway, we always address the life-threatening injuries and intervene that life-threatening injuries, following which will push the patient directly to operation room or ICU based on their requirement. Bypassing the CT workup, then we need to talk about our team players. Apart from our triage nurse, emergency consultant, we have other supporting staffs like radiographer who helps us with bedside imaging like X-ray chest and X-ray pelvis. We also have a blood bank staff who supports us by providing adequate blood products for massive transfusion of trauma patients. Then closing the line, I would like to say from stretcher to scan, from scan to theatre, every second counts. Road accident might change anything in a second, but an organized team care improve the outcome at the same seconds. Thank you.